to Our Special Lives. Today we're starting a 3-part series for children with feeding tubes on feeding and venting. These videos are going to cover the how-to and some top tips for gravity feeding, syringe feeding, and venting for children with feeding tubes. We're not specifically covering feeding for infants less than a year old or children who use feeding pumps, but there are similar concepts and ideas. So even if you're feeding an infant or using a feeding pump, I encourage you to watch anyway. And before we get started, if you like these topics, please hit like and subscribe if you want to be notified of future videos. Okay, so let's get started on the first topic in this series, which is so fundamental to feeding and venting, but I feel that it doesn't get enough attention. And that is being aware of a child's comfort and connection during feeding. This topic is so important because it sets the tone for your child's experience and happiness during the feeding process. Putting some thought in this area can really optimize a tube feeding experience. Whenever someone feeds a child through a feeding tube, making sure the child is comfortable and that it is a positive experience, or at least not a negative experience, is very important. Sometimes a tube feeding can be very stressful for a parent and child, particularly if the child has a history of vomiting or gagging and retching. When your child is verbal or speaks, it's much easier to understand whether they are comfortable or if they're starting to feel pain or nausea, because they can communicate that to you. Many feeding therapists will advise that it is often counterproductive to continue a feeding when a child feels uncomfortable or sick. But on the other hand, parents can feel enormous pressure to keep going because they want their child's basic nutrition and hydration needs to be met, or they may be wanting to closely follow the instructions of their doctor or therapist. This can cause a negative feedback loop with a child that can make feeding issues worse. I would urge you to consult your feeding therapist to find ways to make your child more comfortable if this is happening with you and your child. Make sure that you explore what you're feeding with your child with the dietitian to see if something in the food could be causing discomfort. For example, my son doesn't tolerate certain foods and they cause intestinal distress and bloating, which can be very uncomfortable. Sometimes children have less issues with blenderized food or real food put into a blender than commercial formula, so that could be something to explore. Sometimes positioning during feeding is the issue. Sometimes the feeding speed or the amount of food or excess air can be the issue. Sometimes the parent is so stressed that the child can pick up on that stress and become stressed themselves. All of these issues should be examined if your child is feeling uncomfortable. If you suspect that something serious is going on, of course, involve your child's medical team. For example, in cases of chronic reflux, where food and acid may come up into the esophagus, sometimes without parents even knowing it, there are medications, positioning techniques, and even surgery that can mitigate that condition. The bottom line is that there are a lot of things a parent can explore to make feeding a positive and comfortable experience for the child. If your child is nonverbal, it can take a little bit more observation to know whether your child is doing okay with the feeding. You will have to be more aware of nonverbal cues, such as body movements, facial expressions, or other changes that equate to pain or discomfort. To give you an example, when we feed our son, we're first conscious of his normal baseline state. He's typically happy and engaged. He often smiles and laughs. He rarely cries or winces. We understand his normal movements and facial expressions when everything is going okay. Some signs that he's not doing okay with the feeding are he goes from being happy and engaged to very quiet. The corners of his mouth turn down, like he's sort of feeling nauseated. His breathing rate may increase. He starts salivating a lot. His face can become kind of discolored, either pale or kind of reddish. He may start whining or wincing. His tongue can kind of push out of his mouth and he may kind of start gagging. This usually indicates that he's very close to vomiting. Take a minute to think about the last time that you felt sick during or after you were eating or right before you vomited. Were you salivating? Did the corners of your mouth turn down? Did you become really quiet or start breathing a little heavier because you were so uncomfortable? The signs that we feel are typically the same as what our nonverbal child is feeling. So what can you do if this happens? I think every parent should have a plan B for tube feeding in place. And this may be something you create with your GI or feeding therapist, or you may develop it on your own over time. Plan Bs are very individualized because children are different and they all show different signs of not feeling well or not doing well during a feeding. Also, if anyone else is feeding your child, like a nurse or a caregiver or family member, that Plan B can be communicated to them as well. To give you an example, this is our Plan B. First, we're aware of the signs that the feeding is not going well. We'll talk about this in another video, but continuous observation is one of the key elements of successful tube feeding. If any of the signs are observed, we immediately stop the feeding. We've learned that hoping things will get better and continuing to feed is typically not a good idea and almost always leads to vomiting. So we don't wait for multiple signs. One sign is enough for us to take a break in feeding. The next thing we do is we immediately vent our son's stomach, which we'll talk more about in detail in another video. But by venting the stomach, you'll do two things. One, you'll release any excess air, which could be building up in the stomach and leading to an overly full feeling, which can cause nausea or pain. It also allows any excess food to come back out of the stomach to relieve some of the pressure. If a lot of food comes back out into the syringe when you're venting, you may want to throw some of that away and allow the stomach time to digest the remaining food. You may need to quickly reposition the child to vent effectively. For example, a child may do well eating while sitting up, but may vent more effectively by being reclined. Quickly taking these steps can not only relieve the discomfort, but you may be able to prevent vomiting and losing the entire meal. The key is being observant and having a plan B that you can quickly fall back on. Next, you'll want to consider whether you want to restart the feeding. You'll definitely want to allow some time to pass and take into consideration where you were in the feeding. If you're close to the end of the feeding, you may want to stop the meal altogether. It's normal for all children, tube-fed or not, to require less food or more food on different days or at different times. Sometimes when our son is in a growth spurt, we notice his stomach motility is increased. His stomach may growl more often, and when we vent him, we see very little stomach contents or food remaining in his stomach. Other times, we can see that he has more stomach contents than usual and fills up faster, which means he's just not requiring as much food at a certain meal. If you were in the beginning or middle of a feed, you may decide you want to keep going with caution after taking a break. In our case, if we decide to continue the feeding, we typically allow 15 or 20 minutes before restarting a feeding to allow time to digest, particularly if a lot of food came back out of the stomach when we vented. Then we'll go at least twice as slowly as we did in the beginning, venting frequently and continuing to watch for signs of discomfort. Whether you decide to restart the feed or if you've had to engage in Plan B, it's also a good idea to do a little investigating. If your child does not normally become uncomfortable or nauseated during meal times, what was different about this one? Was there something different in the food? Was there more food, or was the food fed at a faster pace? Was the meal closer to other meals or free water than usual? Have any medications changed? Could your child be constipated? Was your child in a different position than usual? For example, our son has cerebral palsy and has very low tone through his midsection. We have found that if we feed him while he's upright or seated, he slouches a little through the middle, and it decreases his stomach volume, which can lead to him being uncomfortable or sometimes even nauseated when we feed him. We have learned that he does best by being fed laying down on a feeding wedge. Some children need to be more upright, like being reclined in a wheelchair due to reflux. So being aware of a child's optimal position is important. Again, we'll talk about this in the venting video, but some children don't release air as well in certain positions, and that air buildup can make children nauseated. So thinking about positions not only for feeding, but also for venting is important. And be aware that sometimes those positions are different. Lastly, it's important to take into consideration the environment where the feeding is taking place. Basically, you want to feed a child in an environment where they can be happy and relaxed. Feeling stress while eating can be counterproductive to any child's eating experience. Think about the elements or the type of environment in which you'd like to eat and in which you don't like to eat. Noisy or quiet, messy or clean, rushed or relaxed, with people who are happy or people who are stressed, with people ignoring you or interacting with you and noticing how you're feeling. Children often have the same preferences. If a child feels like their signs of discomfort are routinely ignored or missed, it may be hard for them to relax during feeding. Consider whether it's possible to feed the child with the family at times, or at least with a family member or caregiver who can positively interact with them during the feeding and observe any signs of difficulty. Even if a child is nonverbal, assuring them verbally that you're noticing how they're feeling during the feeding can be comforting. Maybe the child likes listening to music or likes to hear you singing. With young children, maybe they can be held while they're tube feeding. If your child can safely take some food by mouth, offering bites of food that they can play with or taste while tube feeding can make the meal more enjoyable. I hope this video has given you some ideas to think about as you tube feed your child. The other videos coming up in this venting and feeding series will focus on specific techniques for feeding and venting. If you liked this video, please hit like, and if you want to hear more about these topics, please subscribe. Please leave us a comment or send us an email at ourspeciallives.com. Thanks for listening.